Good morning. This is Dr. Kordestani. I'm here with you from the Ward Institute. So this is one of our many different educational episodes from the Ward Institute. And today I wanted to speak to you about body lifts. Actually, specifically what we wanted to talk to you about is patients who go through massive weight loss. A significant number of patients now, fortunately, luckily, have gone through massive weight loss. Some have gone through surgery. Others have gone through things like Ozempic and Mounjaro, and they've lost a great deal of weight. So that is a great success, and I commend you all. The problem that we run into now, unfortunately, is after the weight is gone, you are left with a significant amount of skin that just seems to just hang. Many of the patients are very happy that they've lost the weight. They're happy physiologically. They are in healthier conditions. Everyone's happy about that. So are we. Again, the unfortunate problem is now you're kind of stuck in the middle, half picture, because now all that excess skin is hanging. The most common areas that seem to bother patients is the truncal area and the breast area. Other common areas are the arm. A lot of patients come in and kind of jiggle their arms and tell me they have bat wings. And then other things where people have medial thighs because when they wear their clothes, their medial thigh skin seems to still abut each other and get in the way of their actually walking naturally. So this, again, makes patients feel like they've gone through half the journey. It's incomplete. One of the most common operations that we see is truncal surgery. So for post-massive weight loss patients, one of the operations we do and have seen routinely is a body lift. What does that mean? A lower body lift is when we actually do a tummy tuck, but we don't stop at the edges or the flanks. The incision goes all the way around, or a 360, as you would say. And that helps us to free up all the extra skin that seems to sit and weigh down the midsection of the body. And then also it helps us to lift the buttocks area and lift the flanks. This allows us to get a better contour to the buttocks, better contour to the flanks, better contour to the back, and better contour to the abdomen. So as we were saying, basically it is a surgery that's 360 degrees or all around. Another name for it is a 360. Another name for it is circumferential. So that helps us to really resect, free up, and get rid of a lot of the truncal excess skin. There's other permutations of this operation. There are a standard abdominoplasty. There is an abdominoplasty with a midline incision, so we can actually take away a lot of the skin in the mid aspect of the trunk. Who needs what? That's a fantastic question. Unfortunately, the only way to know it, because everybody is different, everybody's had a different response to the weight loss, is to really come down, sit down, at a no hassle kind of consultation and really just look at you and see what bothers you and what surgically is possible and safe to remove. Once you get evaluated, then we can actually think about scheduling this to really go through and get rid of most of the excess tissue around your abdomen. Again, this would be considered what we would call the lower body lift. A common thing that immediately is asked of me is, what about lipocontouring? Lipocontouring in its own sake is actually good. But if you kind of think through this logic, most patients who've had massive weight loss have lost fat. They have skin left over. Well, if you don't have a lot of fat, it doesn't really make sense to do any kind of a lipocontouring because you have no fat. The issue is excess skin. If in fact you think you need lipocontouring, be happy to discuss it, but most patients don't. Usually there's a skin resection operation and we really try to not overcharge you, do too many procedures. If it makes sense, absolutely. And if it doesn't, our job is to be very clear with you, transparent, and make sure you don't get an operation you don't need. Other operations that tend to come, of course, a mirror to this or an upper complement to this is an upper body lift, which is a 360 in the chest area where we can actually take away the skin in the upper chest from the back along the bra line, and that morphs into actually doing a breast lift and in some cases an augmentation. So that tends to take skin away and tends to make the breast and the upper chest area a lot more contoured and fitted from what you have to what you want. So again, these are many operations for the post-massive weight loss patients. And I would encourage you to come in, sit down with us so we can go through this and catalog what is needed for you. Again, the idea is not to sell you anything, but to see what would be ideal for you to make you happier in this journey.